Welcome to Your Family's Health. This is Joan Buckley from the Department of Nursing here at Nassau Community College. Your Family's Health is a program focusing on healthcare issues and the resources available to you here in Nassau County. On the show, we speak to experts from around the country, and we try to bring you in things that are up to date and current in the trends and issues of Nassau County's healthcare. So today, we are speaking to Jim Cullum. And it's kind of a different topic, but it's going to be about hypnosis. So if you want to know more about how to stay healthy in Nassau County, stay tuned for the next half hour to the Voice of Nassau Community College, 90.3 WHPC. So welcome to the show, Jim Cullum.
Thank you very much. It's a pleasure to be here.
Well, we've waited to have you on. You know, with the winter and everything, everybody's been kind of indoors. But so who's Jim Cullum? Like, who are you? What brings a person to be so focused and so interested in hypnosis of all things? It's almost like a magical part of healthcare, hypnosis.
It's very different. This is quite true. I started out way back in the 70s, actually, as a nurse. And I met a fellow nurse who introduced me to hypnosis. She was very interested in taking this course, and she begged me to go with her. And at the time, I really had no interest in it. I took the course, and I fell in love with it. I was so impressed with what a person can do with their own mind.
But a person doesn't do it by themselves, right? Hypnosis is usually administered by a hypnosis specialist, which is you. And you've taken it on to nursing. That's really so apropos, because we're always looking for things to make patients feel better and to understand what they're going through. So this is like a wonderful connection for me to actually have you be part of the same profession. So what exactly is hypnosis? Like, some people, I think, you get so much of the TV part of it. What is hypnosis to the everyday person that's experiencing something and seeks an alternative form of treatment?
The simple two-word definition of hypnosis is focused concentration. When you focus all your attention on one thing and you block out all the distraction, you're in a state of hypnosis. Now, what most people fail to realize is that this is a natural state that we go in and out of dozens of times every day. I'll give you two examples. One, you're driving your car. You're going to a familiar destination and your mind's on a thought. What you're having for dinner later tonight when you're home, or you're taking a trip on the weekend and you're thinking about the trip, and all of a sudden you arrive at your destination and you'll say, wow, I don't remember driving the last half a mile. The car got me here on automatic pilot. We're here already. And that's highway hypnosis.
But what about when you end up at a wrong destination because you think your car knows the way to go, and you're also probably under the influence of other thoughts? Well,
if you're not in that hypnotic state, if you're thinking consciously, it's a whole different mechanism altogether. Yeah.
Different.
Now, a second form of hypnosis, and this is really interesting, maybe you did it yourself, and if not, maybe you know friends who have done this. When you were in school, someone who never opened a book but always got above 90 on a test, that's the person who in the classroom, they were so focused on the information being presented by the instructor. They block out all the distraction. All that information goes right into their subconscious mind, where your long-term memory is. They know it. They know it. Why waste time studying? I already know this stuff.
Well, that wasn't me, but that's a good analogy, because there are people that do so well and they don't have to seem, or it seems like they're not putting that much effort. But it's effort to focus. I think it's easier to not focus than it is to learn. Can you learn to focus?
Exactly. And that's what when we teach people to do self-hypnosis. Mm-hmm. Most of the work that I do, if I'm working with pain control, I'll teach the client in the chair to do self-hypnosis, because if they're having pain at 3 o'clock in the morning, you don't call me. You can do it yourself and take care of it. And for study and recall, there's many reasons we teach people self-hypnosis, so that they can go home and practice and become comfortable doing it. And the more you do it, the easier it becomes.
So then hypnosis is really just focusing, a different way of what people think of as focusing. So why do we always feel, and this is my own perception of hypnosis, is that someone does to me. Someone does to me. So what is your role as someone who specializes in hypnosis for things like you said, pain control, smoking cessation. I mean, you have a huge, when you go to your website, there's a huge list of things that hypnosis can play a really, really big part in. So what's your role then at that moment? Is it to get me to focus like so quick? Like, can you get me to focus so quick? Like, I don't want you to hypnotize me now, but so quick. How long does it take to get someone to, when you're working with them?
Depending on the person.
Yeah.
You can have some people go into a state of hypnosis in a matter of 10 or 12 seconds. And other people, especially those that I'm teaching to do self-hypnosis, it might take 5 or 6 minutes if I'm teaching them a nice, comfortable induction that they can do at home and they can practice on themselves, and they're comfortable doing it. They're not afraid. I mean, they can learn to do hypnosis very quick, the self-hypnosis.
I don't know. Am I hypnotized? No. So that's, but, so, okay, so how does it work, say, in the movies, it always looks like someone says, okay, you're feeling sleepy. Is that like not a real way of hypnotizing someone? Or is it not hypnotizing? Hypnosis different than hypnotized?
Well, no, it's
the same?
It's the same thing, but here's what happened. Now, hypnos is the Greek word for sleep. And that was coined by a Dr. James Braid back in the early 1800s, because when you would hypnotize somebody, now, unfortunately, the listeners won't be able to see this, but when you put somebody in a high back chair, almost similar to what I'm sitting in now, and you hypnotize them, their body goes like this.
It just happened. No, I'm only kidding.
Your body becomes extremely relaxed.
Yeah.
The muscles let go, so you sort of melt down. That's why when people come into my office, there's a nice, comfortable recliner that they can melt in. You're not going anywhere. You're safe. You're comfortable. In a chair like this, like I said, when the doctors 200 years ago would hypnotize somebody and the body relaxed, you sort of melted down. And they assumed, and we know what that means, especially in the nursing field, you never assume. They assume they were sleeping. But in a state of hypnosis, your mind is more awake and alert than it is now.
So what is the role then? So what do you elicit during a session, per se? Like, what could someone expect if they went in for a session and perhaps it was on pain management and you were teaching me how to self-hypnotize? What would I expect? Like, what would I expect to happen when I came in for, say, the first visit and the second visit and possibly the third? Like, what's the progression? Like, what are the steps?
Well, anytime we do pain management, I need to inject this in here very comfortably.
Yeah.
When I do pain management work, I must have a written referral from the physician to work with a client for pain management. Because I'm not a physician, I do not diagnose.
Right.
And I have to have the okay. And once I have the okay, and I've never had a doctor in 32 years of doing this, I've never had anybody refuse. I've had doctors from as little as writing on a prescription blank, hypnosis is not contraindicated for this client, this patient, all the way to getting a half-inch thick file with copies of MRIs and CAT scans and a little note, please do whatever you can for this patient. She really needs your help.
Wow, wonderful. That's wonderful. That's respect from almost like a conventional medical team for the non-conventional or the... Do you consider hypnosis part of the psychological nursing piece, or is this totally outside healthcare's norm? Like, where do you fit?
It's not totally outside the norm. It's not a... Well, there are some, psychologists and psychiatrists that utilize hypnosis in the work that they do. I have a couple of colleagues who are psychologists and psychiatrists who will refer patients or clients to me because they don't do hypnosis.
Okay.
And they feel that it could be a benefit, and they'll tell me what they want me to do, and then I do what they want me to do. When you're in a state of hypnosis, as I said before, you are in an area where you have control over your own self greater than you do when you're just consciously doing things. When you're in that state of hypnosis, if I can quote a very quick study that was done at the University of Michigan, actually.
Sure.
They took 3 doctors, took a group of students, and they taught them how to do self-hypnosis. They combined it with imagery, visual imagery. They showed them microscopic slides of neutrophils, which for our listeners are a particular type of white blood cell that fights infection. The students would go into self-hypnosis 3 times a day for about 15 to 20 minutes each time, and they would visualize the neutrophils in their mind. And they did that for 3 weeks. At the end of 3 weeks, these students could, on demand, either greatly increase or decrease the amount of circulating neutrophils in their bloodstream just by picturing it in their mind in that state of self-hypnosis.
Wow, what a connection. The physiology to the mind.
Exactly. There have been studies done, and this is not new. Back in 1989, a friend of mine who is a psychologist, her husband was a dentist, and he developed colon cancer. And he had to have his entire large colon removed, and they told him he would need 3 units of whole blood. Now, back about that time is when they discovered that AIDS had slipped into the blood supply. They weren't testing. They didn't know. And I think the first case we had on Long Island was a gentleman that went in to have his gallbladder taken out at the time. You know, they weren't doing the laparoscope. And
right.
So it was 1 unit of blood for a transfusion, and it was contaminated, it had HIV, and he developed AIDS from having a gallbladder surgery. So there was a little panic going on, and this dentist, again, a medical person who's well enough aware,
yeah,
he was afraid because they told him he'd need 3 units of whole blood because of all the cutting they had to do. So he said, oh, this is great. They told me I have a 95% chance of being successful of getting rid of the cancer, and now I'll get a contaminated unit of blood. I'll have HIV after this. And he was very upset. So his wife had remembered at a luncheon that we had one day, I had mentioned about they were teaching hemophiliacs to do self-hypnosis to control bleeding. So she said, I wonder if you could work with Mitchell to help him control the bleeding. So I said, you know what? Let me do some research. Now, this is 1989. This is before the Internet made everything easy.
Geez.
So I was at the Shell Medical Library on Stewart Avenue, and I spent 3 days researching through the Indicus Medicus dozens of studies that were actually done at hospitals and universities by medical doctors on how effective hypnosis could be for surgery. You need less anesthesia to get you to the depth they need you to be at to do the surgery. Your wounds heal faster. You have less discomfort or pain. You can prevent post-op urinary retention. And there was 18 individual studies that were done. I said, this is great stuff. How come they're not doing this? Well, I put it all together into a program that I'll work with clients before they have surgery. And he was my test case on this. I put this together for him.
Yeah.
And he went in, he had the surgery done. I went into the hospital. He had this done at Mount Sinai. And I went into the hospital the first day post-op. And I walked into the room, and he was lying there, and he goes, oh, you missed my surgeon. He was here about a half hour ago. He said, you know, first when he came in, he went to change the dressing, and he told me, Mitchell, how come you didn't tell me the resident came in and changed your bandage this morning? He said, they didn't change it. This is the same one you guys put on in the OR yesterday. There was no drainage. There was no blood on the bandage. He needed no transfusions. It took 47 staples to close the incision, yet he still needed no blood at all. He did well. He got up 7 hours post-op out of his bed, and holding on to the IV pole, he walked around the hospital corridor for 3 hours.
Wow. Did anybody try to stop him? Because not knowing the norm, they probably were like, sit down, let's go slow. No?
Well, the nurse walked with him initially for a little while because she was concerned, and he was hooked up to the controlled morphine drip, which they then, while I was visiting him the first day post-op, the nurse came and she said, Dr. Markowitz, and I can say his name because he gave me written permission to publish this. It's okay.
It's okay.
He gave me a 2-page letter. He wrote he was so impressed with how this came out.
Yeah.
He was really impressed. But she said to him, if you don't ring for the morphine, they gradually cut you down. He goes, do I really look like I need pain medicine? I'm in a good place. Leave me alone.
Oh, that's so funny. Do you get resistance, though? Not from physicians. Obviously, physicians, you're not a last resort, but I think in many cases, you're not the first place people go because you don't think of it. And you have to look back at the history. My I'm in my 60s, and my idea of hypnosis is at not a carnival, but in the carnival setting, the magician